Good evening, dear Foxians. I fills my heart with immense joy and gratitude to welcome you all to Gyan Pravah, a special podcast conceptualized under the leadership none other than Dr. Sunita Tandulwadkar. I am Dr. Sejal Naik, chairperson of Fogsi Endoscopy Committee, and I will be here with you on 8 p.m. on 8th of every month, meeting, conversing, learning from legends in our field of endoscopy at Gyan Pravah, Flow of Knowledge, a platform that promises to enlighten, inspire, and elevate all of us. On this special occasion of International Women's Day, today, it's a moment feels even more special. It is an honor to share this platform with true pioneer, a force of nature, and a woman who has redefined leadership, Dr. Sunita Tandulwadkar. Along with her, we are honored to welcome a trailblazer in the field of gynecological endoscopy, Padma Shri Dr. Manjula Nagani, as our esteemed guest speaker today on the podcast number 39 of Gyan Pravah with Endoscopy Committee. I have an incredible honor of being in presence of two towering icons of Indian womanhood who have shattered barriers and continue to inspire generations with their brilliance and resilience. We welcome you, madam. I would like to invite Dr. Sunita Tandulwadkar for her visionary welcome address. Before that, I would like to say a few words about Madam. She is a visionary guiding 46,000 gynecologists of India as the President Fogsi. She has been instrumental in revolutionizing gynecological endoscopy, high-risk obstetric, IVF, oncology, robotics, ovarian rejuvenation, and stem cell therapy. Her contribution have placed India on the global map. She has established her role as a leader in various associations, IAG, ESAR, or the founder president of Society of Ovarian Rejuvenation, and she is also a co-founder of Alive, Indian leading stem cell research center. She has pushed all boundaries by and making everything possible which were impossible. We thought so. She made history in 2018 by delivering India's first stem cell baby, making a milestone in medical innovation. Her
Thank you,
leadership.
Sejal. Let's celebrate today, the 8th March, celebration of a woman, and we three are in one frame. The endoscopic surgeons of country itself is our empowerment. Sejal, I know you are not going to end. The podcast is not for Dr. Sunita. It is for Dr. Manjula and Sejal. So I needed to cut you. I'm sorry for that. But today on a Women's Day, it is such a fantastic celebration for all of us. Only it pains when only one day is celebrated as a Women's Day. I think 365 days, we all celebrate ourselves. Today, when you have chosen such a fantastic, and I'm happy that you chosen Indian lady, Indian superstar for this 8th March special episode. Manjula, my dear friend for more than 2 decades, a lady with the golden heart, traveled with me across AP Telangana, traveled without me also in AP Telangana for my election. That is the friendship we share. Sunita, you can't come, no worry. But what is important, Sejal, I know you are supposed to introduce her, and I'm not going to take out that official introduction. I want to say you only few things. What is important, it is the way you treat the people, the way you make them feel, that will be remembered. Manjula has treated me like I am the most deserving candidate of the country, and she has to work day in and out for me. Believe me, Sejal, during our election campaign, what I noticed is this lady, not only just my friend, you call me your mentor, but I have met hundreds of her students. entire AP Telangana. And when we used to walk in the conference room, they used to run to touch her feet. And that I cannot forget. That shows how much love this girl has put in her students. आज के बच्चे इतने जल्दी पाँव नहीं छूते हैं, नहीं होता है. And it's not once, it is several occasions in several cities of AP Telangana wherever I moved. And on the way to that city, we used to give a call to all our students, remaining thousands of students, to talk to them, and I say hello to them. First thing they used to say, "Oh, you made our day. Dr. Manjula madam is calling us. Our day has made." So the amount of happiness when Manjula calls, "Manjula, keep your these qualities." I visited her hospital, her center. I saw the amount of discipline she has in her clinic environment, the respect her staff giving it to her, all was amazing. So that is a different side of Manjula. I don't think, Sejal, you would have been able to tell, especially the girls moving, and they were, must be the 15 years and 12 years and old fellows, not like yesterday's fellow. So when I went to Delhi this time and Lucknow, for example, when I meet my past fellows, I share that. But probably they were doing fellowship under me and all different story. Here, Manjula is not doing anything but her personal fellowship programs. And the amount of respect she has in the minds, probably she must be treating them as their child. Manjula, I know you are a fantastic mom. You have an adorable daughter, and that Sejal can talk about, but her daughter is equally proud of her, and she is amazingly fantastic, beautiful woman she has raised into. So Manjula, I'm very proud of you, and I'm thank you for coming on Fogsi platform today.
Thank you.
Absolutely, it's an
You are-
honor.
You're making me so emotional, actually.
No, Manjula. The world doesn't know this side of Manjula. Foxy doesn't know this side of Manjula. Maybe the IAG knows, but Foxy doesn't know this side of a Manjula. And I wanted to tell you this, that we love you, we respect you. Thank you.
Thank you.
It was straight from President's heart, madam.
Yeah, really, you guys made me so emotional today. I don't know.
No, these are the friends I cherish. I have picked up so many friends across, and I'm thankful to God for making me face election. If elections would not have been there, these thousands of my friends, which I have strengthened the friendship. Manjula was my friends for a year, but we used to meet in the workshop, conferences, sharing the dialogues, not knowing so much of a personal history. Elections have given me that thousands of my friends across the country, and I'm thankful for that. The position is only for 1 year. The friendship which I made with you all is my lifelong achievement. Thank you.
Thank you.
And ma'am, we are really grateful. You are giving us such an opportunity to discuss on this platform regarding the individual personality, which was like we never get the opportunity to talk about their professional journey, their personal issues, and then they breaking the barriers, as you said. So we are really, all chairpersons are really grateful to you for giving
Thank
this
you.
opportunity.
Thank you.
Thank
dear.
you, madam. So today's podcast on the defying odds, I would like to introduce our today's speaker, none other than Dr. Manjula Nagani. So we are honored to welcome you, madam. The Padma Shri Dr. Manjula Nagani, the name synonyms with the excellence, precision, innovation, and she has transformed the landscape of women's health through her pioneer contributions in laparoscopy and robotic surgery. Dr. Manjula is a Guinness World Record holder, Padma Shri awardee, and the first surgeon in Asia Pacific region to perform gynecological robotic surgery using RAS system. As the clinical director and head of department, Care Hospital and a Reach Hospital, Hyderabad, her leadership has redefined medical excellence. With over 25 years of clinical and academical expertise, she has been recognized globally for her exceptional skills and unwavering commitment to advancing healthcare. Her accolades include multiple Lifetime Achievement Awards, Surgeons of Excellence recognition by USA, and contributions to regenerative medicines and ovarian rejuvenation as well. But beyond her remarkable professional journey lies an even more inspiring story, one of the resilience, strength, and positivity. Despite facing personal and professional many challenges, Dr. Nagani continues to push boundaries, proving that no obstacle is insurmounted when passion meets perseverance. Today, in this exclusive interview titled Defying Odds, we delve into the extraordinary journey of a woman who has not just broken barriers but built bridges for future generations. Dr. Manjula Anagani is more than a surgeon. She is a visionary, a mentor, and a role model for women everywhere. Welcome you, madam.
Thank you, Sejal. I had a mind to stop you just the way Dr. Sunita stopped you, but then I thought, okay. Thank you, Sejal, for having me. This is really an honor to be on this platform to talk to you about it.
Thank you, Manjula. And as our protocol is, you and Sejal will continue to have the dialogue, the beautiful podcast, and I'll be listening from other link. Love you.
Thank you.
Thank you, madam. Thank you. So, madam,
yes,
we would like to know about your journey in endoscopy. You are a pioneer in gynecological endoscopic procedures and having included the performing the first gynec robotic surgery. What inspired you to pursue this challenging field? And what have been the most defining moments in your endoscopic journey?
Thank you, Sejal, for this fantastic question, because like we all talk, it's the beginning which makes the difference. You know, when you join into a medical college, there's always, all of us go through three particular subjects. One is anatomy, physiology, biochemistry. Whenever I guide people, when these people come to us for mentoring, I tell them, you know, which subject did you like in a medical student? If it was anatomy, that means that your innate ability is towards surgical field. If it's physiology, it is towards medical field, and biochemistry, that is analysis. So that will be pathology or biochemistry or radiology. We need to understand our innate ability, because everybody can do anything. It is just like anybody can dance, anybody can sing, anybody can do. But the people with innate ability will have a shorter learning curve. With acquired ability, will take longer learning curve. That's it. If we want to do anything, nothing is impossible. So when I did my anatomy, then I got a distinction in anatomy, and I used to love knowing all this and getting it surgical. I knew I would be a surgeon. And by the time I came to the house surgeoncy, everybody was sure that I would do general surgery only, the way I used to do. As a house surgeon, I did one amputation, one GJ, one everything possible. But in 91, 92, when I was doing the house surgeoncy, when we look around, in the audience, in the people, general surgery is completely a patriarchal world. Women would not go to a woman or surgeon for a general surgical problem. So how is it that we are going to break barrier? I'm not going to be a good general surgeon with no work. Then there is 50% of the world is women. So when 50%, can I serve these women who come to me with the surgical differences which we can make and make a difference in their lives? So that's when, instead of being a general surgeon with no work versus a lot of work, then trying to change and pursuing what we want to do. So we need to understand our purpose of life. Then comes our passion. Then comes our profession. All three are very important. And whenever we have all these three in the same place, then there is no limits, no barriers which we cannot break. We can touch whatever we want to do. So luckily for me, all three are same. My passion, my purpose, my profession are the same. So I knew that I would do general gynecology. But then again, all the barriers will start coming. But like we all say, when somebody is destined to do, that's what it is. And I always tell that I'm God's favorite child. So and I always I have this eidetic memory in the sense like if I see something, do something, I'll never forget in my life. It's like a .com. So it's Manjula.com, Google.com, Manjula.com. So when I wrote my entrance, I come out and tell these are my marks, this much I'm going to get, exactly like that I will get. So when we wrote our PG entrance, and I knew I did it very well, and when we came out, we got the marks, I was not happy with what it is. So immediately, I'm always a born rebel again anyway. So I went into the court. Then when the court judgment came, in that 1 year, I did my MD pathology and gynae pathology of 4 months. And when the time that the judgment came, and they said the whole, you cannot believe it. It still happens even today. The answer sheet is completely different from the question sheet. So the whole thing was scrapped and remarking was done, and I got my gynecologist seat. But the court did not remove the seats of the previous, so there were 2 batches which did. So I got my destined gynecology and the gynecology. So I would always tell people, if you do well and you're sure that you do, you should not back off from anything. You should fight for it when you think you deserve it. So, and then by the time in 94 to 97, when we did, everything was about open surgery. And I looked around, people coming, and somebody has to come from village, loss of work and everything. And world was changing. Minimally invasive surgery was coming, but in government, it was not there. So I came out in 1997 and I was having 2 pathways. One is reproductive medicine. So I went to get trained for IVF, including the ICSI, which was just coming, then laparoscopic surgery. Being a surgical hand, like I said, and you want to do surgeries, you will never be happy with IVF and everything. And after getting trained with IVF, unfortunately, at the same time, one of the IVF center in Hyderabad, the Dr. Saraswati, who was running it, and I had an accident, and she asked me whether I can help her in running the center. So 23 days of running the center, I could not take it because people would cry. The success rates were 30-40%. People would come and cry when it fails. And they were like, I sold that, I sold this and everything. So I said, this is not for me. For me, people have to be happy, whatever we do. We remove the baby, they should be happy. We remove the uterus, they should be happy. We remove anything, they should be happy. So that made it. That is a decisive moment for me when I said minimally invasive surgery. Now, when we go into minimally invasive surgery and we started making the difference, yes, you said hurdles. Lot of things would be there when it comes to the thing, when it comes. First thing is there was no awareness among people that there is something like this. But I was very lucky. All my patients used to say, I think the way we talk, the confidence we show, whatever you say, doctor, that is the thing. That supported me. But when it happens like that, we need to understand it is a patriarchal society, whatever you say or not. The ports which were there at that time were all the triangulation and contralateral. That was a huge difference which I had to do. I was literally had to fight with my colleagues, general surgical colleagues and everybody that it doesn't have to be contralateral, it has to be ipsilateral. Only 2 rules of endoscopy are safety of the patient and comfort of the surgeon. So that's how we had to fight with a patriarchal society. There was another thing which was quite common in those days that people never used to believe when they said that Dr. Manjula is operating. No, behind the theater, somebody else must be operating. You know, that does thing till seeing is believing. In 2005, when we did a live operative workshop, that's when people really realized that what sort of surgeries we were doing. So and then there was also second thing was, our colleagues. There always used to be that, no, don't get a minimally invasive surgery done, there'll be bits left over. So there's always a resistance from people, colleagues who say that what we know is the best. We never have to fight with them, Sejal. If we fight with them, we are wasting our energies and time. Ignore. You just have to continue doing what you're doing, and time will come when the next generation, like you all, take it as a norm. So I just believe in that when we continue doing it, people will forget, and future people will say, oh, there were times when open surgeries used to be done. So I'm hoping for that day to come. And then comes, the awareness level, how to improve. So luckily for me, I started a lot of awareness columns in the media, because when we say it's only one-on-one, when the media comes into picture, it's going to be a huge awareness thing. And it's always demand and supply. So when patient demands, people have to do it. So that's how the huge thing. And my patients were always my huge support. So when all these things started happening, then like we said, somebody is mentoring, then we understand when we look around, then you say that support systems are the more important. This is a small thing I have to tell you here. I used to be a consultant, youngest consultant with the Apollo Group. With 3 years post MD, I became a consultant there. Then Apollo did not want to buy Harmonic because no, it's not necessary. Why should we do that? Where is ROI? That is a thing. Then I bought I was the third person in India to buy Harmonic in 2000. So I bought the Harmonic then for myself in those days when people were buying lands and all. So I think when you invest on yourself, when you believe in it, then only you'll see the growth. Then the support systems from the hospitals should be there. And if that is there, you can really reach. And support system from family, because you know how it's going to be, then we can talk about it later. But then support systems are very, very important. And along this way, if your personal health and everything is not good, that also will come. So for me, the ergonomics of women, because you imagine me, I'm like this now. You can imagine when it was 27 years ago, how I was. So tiny puny with shoulders fighting on it. I am always for ergonomics of women and how we have to operate. I used to always say, I want to operate till I'm 80 years. When I want to operate till 80 years, I should not be damaging my shoulders and back and everything. So when it's like Abdullah doesn't come to Kua, Kua has to go to Abdullah. So we climb up on the thing. The table cannot come down. We need to climb up. Make a huge manual table down so we can stand on it, and then energy sources on it. All these things we started. We started doing a lot of live workshops and all. It takes time, but this is how the journey has been. It is never easy. There will be a lot of personal challenges, both health and definitely wealth, because we are investing back into it. And initially, definitely we want to fine tune the things, the primary port. Our primary port is something which my students all do it, because our entry is a different entry. The way we do it's a modified open entry where the complication rate is 0. We never have anything. We just go in. So that is the way we started doing a lot of ergonomic changes, techniques, suturing techniques we have innovated, laparoscopy that way, and then neo-vagina technique. Then we had ovarian regeneration, endometrial regeneration. It's all demand and supply. I think by God's grace, I had patients who needed all this. When others refused, they came to us, and then we could give the results, and results always speak. So that's how this whole thing started. And for me, endoscopy is my life. Minimally invasive surgery. Rather than endoscopy, I would put it as minimally invasive surgery is my life. And the decisive moment for me to go into robotic has been my fracture. I had a leg fracture where I had to start sitting on a stool. And even on the month which I had fracture, I did 45 surgeries in that particular month also. Sitting on a stool, and the hospital made a stool where I sit on it and the stool goes up. So that innovation started again there. Then I thought that if future, we really don't know what's going to be there. So that's when I started doing robotics. And then now we know the advantages of it. Yeah, a choice should be given to the patient, and patient has to choose what they want. Yes, 90% versus 100% what they want to choose is their choice, but we should offer them.
Oh, ma'am, it is like you have faced each and every challenges with such a brave heart and the focus and the perseverance. You have never give up, whatever that you have. So that determination,
Yes.
that is what, and the passion, as you rightly said, the passion and your profession especially should both match. Then you can always do the wonder. So do you think that this iconic women like you, or this, achievers, they do have some different essence or element that they make them apart from the, common, ordinary women? Or it is like something, that greatness thing that they acquire or nurture over a period of time, or they born with it?
Like I told you, Sejal, there is innate and acquired. Some people have innate ability, which we can just find. It is like, when I was preparing for my MSET exam, MSET is that entrance into the MBBS. We all used to be very arrogant in the sense that, how can I go to tuitions? I am very intelligent, with that sort of attitude. Then one of my dad's friend told me that, even the diamond needs polishing. Otherwise, it will never shine. That stuck in my mind. Then I understood that I need to go for this. MCQ preparation is different. Theory preparation is different. And Viva preparation is different. That till that understanding goes into the brain, you don't know how to prepare for each thing. Then in the MSET, that is state entrance for MBBS, I got 58th rank. And my dad was very angry because I did not get the first rank. So it's like that sort of a mohal from where I came. Because of my memory, everybody used to think that I would be getting the first rank, that sort of a thing. Because in school and everywhere, it was like that. So what I'm saying is that innate is definitely makes a difference. But acquired is not equal, not bad. Yes, it might take a little longer time. So people can acquire whatever thing they want. Yes, but imagine today I'm talking so well, without any hesitation. I can talk about anything under the sun. But if you can believe me, in 10th class, when I was called on the stage to talk, I was shivering on the stage and I could not talk a word. I had that much of stage fear. Then I understood that I have stage fear. I have to get over it. It took me from 10th class to my MD final year to completely get rid of it. It took time, means almost 12 years of the complete dedication towards, and every opportunity I has to get up and start talking. So I know by the end of my MBBS, I know that I am shivering inside, but outside it would not see. By the time my MD final year is over, I did not have any fear inside me talking. So I don't think people should give up. You know you have a negative thing or anything, you should conquer it. And it is possible thing. Everybody does not have everything. So I feel that the same way, you're not born with knowledge to do cesarean. But by the time you finish your 3 years of MD, you know how to do cesarean of whatever thing. So it's a recurrent, repeated activity which makes you whatever you are. Whether it is suturing technique or whether you're mastering. So there is a difference definitely between an architect and a carpenter or anything. But if you're a very good person in doing it, your muscle memory will take over. Yes, type A personalities will have zeal, enthusiasm. They'll be extroverts. They talk more, so they demand and take it. And there is a saying in Telugu. Now, I don't know if it's there in every other language. Bina puche to maa bhi khana nahi deti bolke. So that first thing have to come from inside. Everybody has to know themselves, what they can do, what they cannot do, what can be achieved, what cannot be achieved. I feel that everybody has to understand their strengths, their limitations, their challenges, and what is it which is helping them to get over the challenges, the support systems. All these are very important factors. So if you understand your strengths, you work on it very well. Don't subdue them. And if you have your limitations, make them less. Your challenges, you can always get over if you know what they are and accept, no denial in that. And then if you understand your support system, like your family is your huge support, your friends might be your huge support, your hospital might be your huge support. Never forget them. For me, my patients are my huge support, even till today. My students, they are huge support. If you remember all these things, I'm sure that anybody can achieve anything. Yeah, it's the time which takes a little difference.
Where there is a will, there will be a way. So, ma'am, in women, especially in India, they face many challenges, not only the professionally, but each steps while schooling, while in college, while family pressures, and then peer pressure, and so many. And as usually the most problematic area when they give up their profession or they set back in their professional life is the work-life balance they lack. So many aspiring educated women, even gynecologists, could not thrive to that or pursue their career after a certain point of time or the certain level of the achievements. So despite of facing even numerous challenges in your life, you have remained incredibly positive. And how do you find this strength, and what is your mantra in this willingness to go on, or never give up, this sort of the energy? Where do you get all this in spite of so many challenges in professional and personal life?
Thank you. I think this is, again, we'll divide into 3 headings, but everything is inside this. I believe in that. Everything is from within. And my mantra, even till today, is be yourself, believe in yourself. So first thing is, we do not have to change ourselves by peer pressure to become somebody, ape somebody or anything. Your innate thing is yourself. Be empathetic to everything, everybody. Your innovativeness with empathy is what you should be looking at, thinking out of the box. So let us take under 2 headings. One is personal life and professional life. And in personal, again, family and personal health. So I will divide and then tell you how I could do it, if it can help anybody. Professional life, I was very lucky, I would say, because I think my patients, like anywhere, any corporate, anybody, nobody can stop you if you have patience. Everybody wants money, right? So if you have your own patients, they are going to put you on a pedestal. So that has been my huge thing because of my clients. I have my patients and my patients. Both have been very, very important to me in my life when I did that. So when I was going, like I said, being a patriarchal society and fighting against people, general surgeons who were doing left, right, center, all the gynecological procedures. And suddenly somebody says a gynecologist does such a good work, people would not believe. And they would always say, somebody must be doing it. Oh, no, it is not necessary. They must be, all these things. And when, for example, one of the particular when they asked, you must be doing it, no? He did not say no. He just smiled and left, giving the people an impression that he might be doing. That was something. Then my assistant used to get so angry. They used to come and say, Madam, Dr. So-and-so did this. I said, leave it. We will just do and we'll continue. So that cannot change us. So we used to continue doing it. And then we had a lot of awareness workshops. We used to do training things we used to do. And that continued doing in a professional way. But saying a patriarchal society, I would also say the people who helped me, boosting my this are also men. I had my colleagues, senior most urologist, once I was always with corporates. That is what I would say, because my support system, when we do endoscopy with the high risk cases, should always be in corporate. So I was with Apollo, I was with every corporate of Hyderabad and CARE. So CARE was a time when I really rose to a different level of cognition. So in one of the general body meeting, when all the surgeons were discussing in a surgeon forum, one of the senior most urologist said, there are only two men in this hospital. One is Dr. So-and-so, the second is Dr. Manjula Anagani. And I was only 35, 36 that time. And it was like one of the huge compliment coming from that thing, and everybody Then one of the night, again, in the middle of the night, there was an emergency where there's a lady with ruptured uterus with a flat line on the table. By the time we could shift her. So there is this very famous, in fact, he's the world president for the peripheral vascular surgeon, the PC Gupta. His surgery was supposed to be done. And then I said, sir, please wait, I have an emergency. And then he just was standing there and watching me do surgery. So I came, I took out the baby and then corrected the uterus because she didn't have children. First was an abortion, hysterectomy, second is ruptured uterus. So we saved the uterus. And at the end of after everything is over, he tells me, I have never seen any other best surgeon than you. And I'm like, I just did not know what to say at 2:00 in the night. So all these things, saying that I would never say men are all the same. We have, patriarchal society, agree, but there are people who really support it. They are good. So then the word goes. So I would say that was professionally, yes, you're from your colleagues. I broke a barrier from the gynecologists, from stopping them from sending the cases to surgeons to sending the cases to me, even till today. Highest number of referrals, I do the surgeries, are majority from referrals from gynecologists. That comes from the confidence we give to them that we are operating and sending them back to you. We don't keep the patients. Over time, they understand that. And we tell them very clearly, talk to them and tell them, this is the best for the patient. And the next came when I spoke to the patient and said, there are other techniques. Don't go for hysterectomy for everything. So I bought my thermal ablation when nobody in India bought it. I'm talking about 2000 again. 2000, I bought harmonics, I went ThermaChoice, I invested in hysteroscope, everything. So we did everything minimally invasive, like TCREs, we used to do all things, not do hysterectomies. So no hysterectomy, for unnecessary hysterectomies to be avoided is something which we started. We started running the campaigns. All these things we were doing in that simultaneously. So professionally, there was no looking back because of the support systems I had. Then personally, when we are talking about support system, family comes first. But then again, depends on what we do with profession with them. I think we should stop thinking about balancing life. Balancing comes when we are putting profession on one side, family on one side. Why do we have to put on opposite sides? Both of them should be in the same side, that today my profession might be important. Tomorrow, my family might be important. So I made it a dynamic relationship. But for me, my daughter is the most important priority. So my life rotated around her. When she came I was with Apollo, I was practicing from morning 6 to night 11, 12, 1, 2 also elective surgeries used to be happening in the night. Till my daughter was in first class. Once she came to first class, I stopped my evening practice, 0. After 5 till today, After 4:35, I do not work. I start my work at morning 7:30. After 5, I do not work. I'm just there for my daughter, not trying to teach her. And I also believe that we don't have to be super mom, super teacher, super cook and all. I don't cook. I don't teach my daughter, but I'm there for her. And we have to see that things happen at home without any problem. That is what I believe in. And we have to give the best to the family. We have to have a cook who cooks the best. We have to have a teacher who teaches the best. We have to have a driver who takes them around. So we have to make things possible that nothing is having short. But we don't have to do it. We have to make it happen. So this is what I believe in personal life. So that helped me a lot. My mother-in-law, father-in-law used to stay at home most of the time. So that also helped me a lot. But my daughter, and when she came to 10th class, I stopped all my this thing with corporates. I went to Beams, Hyderabad. That is what we did. So it was like a glorified nursing home. Then once she went into the +1, +2 with weekly boarder, I again went back to corporates because emergencies do come. Then once she went off to US for undergrad and everything, I am in my corporate life, but still I did not start after 5. I think if you know your priorities, just being there. So my daughter can never complain that I was never there for her. So I was there for her. I changed from Apollo to Care Hospital just because of her school being 100 meters away from the care hospitals. So that if a parent-teacher meeting comes, I can just go there any minute and come back. So I think if you know the priorities and don't try to put them in the opposite sides, that can be balanced. But saying in all this, the major hurdle for me was my health. And I tell my patients and everybody, don't allow your dreams to be shattered by your ill health. We are there to help you. So let your ill health be taken care by us or doctors, but don't allow. So 1993, 92 December, I had autoimmune hepatitis with bilirubin going to 22, and 93 June, I had a right heart failure with pericarditis and tamponade. And from there started my very bad multisystem disorder with every organ affected, Addison's, partial paralysis of my vocal cord, and my renal tubular acidosis with metabolic acidosis, with pericardial thickening, every organ of my body with my neuropathies. I have two parallel major diseases. One is a primary dysautonomia. I was on ventilator 3 times. And I came over it. And then I have a Sjogren's, which is very active. Right now, I'm on all immunosuppressants on earth. And then now I'm doing very well with rituximab and everything. So my treatment was very wavered till 2005 till I went to Mayo. After that, everything was in a streamlined manner, all my team. So we have to know. We have to be a good patient when we are a patient. Don't try to become a doctor. So I have a team of doctors who take care of me, and I'm a very good patient listening to them. So I do well in my health also. So I think your personal life, your professional life, your health, if everything can be supported with each other. And my patients used to do homums for me when I'm sick. They never get scared I'm a sick person. No, they know that when I'm there 100% to them. People pray for me, they do homums for me, my team, my assistants, like Dr. Sunita was talking about. My everyday, day one of my practice, I was in teams. It's always team. I believe in teams. So people used to come work with me. So people worked for me 10 years, 15 years, or 1 year, 2 years. Everybody's all over India. They are doing things. So I think I'm God's favorite child. So I had support systems. I had huge support system.
My God, madam, I never knew this much challenges you have faced. My God, I think after listening this, I'm feeling like challenges might have also been thinking, oh, this Manjula is my challenge. How to give her a challenge? True, ma'am. So inspirational. Truly. Oh. Let us continue. So, what to ask more, madam? You are epitome of all the obstacles you have overcome with your confidence and just a positivity. You are so sure you are going.
This too shall pass. Everything will pass. Remember that.
So, as we already discussed regarding the leading female endoscopic surgeons and their challenges, today's era also, like, many leading female gynecologist faces challenges in adapting the endoscopic field because of its long learning curve.
Right.
But as you rightly say, your insight and your passion will lead you towards your success in any field. You work hard for it. So you have been awarded for the highest, Padma Shri award. Can't imagine that 10 standards shivering girl on the stage reaching to the highest stage of the honor from the government of India and the Guinness World Record also. So for you, uh, after this journey of your entire life, do you really think this award, accolades, and they really matter in a larger aspect of life?
Definitely it matters, Sejal, because what happens, it's not about what we think about ourselves. Everybody needs that motivation and that recognition. The reason being that if your purpose is to make a difference to women's life, when you say, what is the importance that other people are giving to what you say is very important. So if as Dr. Manjula Anagani, I say, yeah, 10 people can listen anything. But if a Padma Shri awardee is telling, many people would give importance to what we say. So if we are going to make it, there's a lot of responsibility which comes with any award which is given to anybody. So we should understand that and take it in a positive way and give people the necessity of making a huge difference to their own health and make a difference to the woman's health per se into the whole of Indian scenario. So I feel that everybody should deserve what they have to deserve, because that gives them new motivation. And also the need is that to change the woman and women's health in the broader spectrum. So it is very important.
So it just not the proud for you, it is a responsibility
Yes.
on the award receiver, that they live up to the expectations
Right.
even after this the ceremony. So it is sometimes we feel like it's a burden, or it's a you have to be in that idol situation for everyone. So is it a pressure?
Yeah,
Yes.
let me tell you that. Yeah, I agree. People have certain this thing about image, about how we are supposed to be and all that. Yeah, I think we get carried away with that image. Initially, when I started practicing in 1997, it's gynecologist means only sari is important, especially South India. You should know that, like you can see me, see you. So yes, and I used to be, like I said, very tiny tuning. I used to be around 50, 52 kgs and all that. That's the way it is. So, but I used to wear a sari every day. And initially I went to Charminar, Hyderabad means Charminar, and buy one glasses without any power and put it so that to give that look. But it never, after some days, and big bindi. And after some day, bindi became small. This thing came out. And then saris continued till COVID times. People who knew me before COVID know only as sari clad, and that's it. I have saris and saris and saris. COVID changed the whole thing. Then we started literally living in scrubs and then chudidars, and what makes us more comfortable. Yeah, so I think image is something, after a particular time when the name comes forward, image goes off. People come to for Dr. Manjula Nagani rather than sari or whatever it is. But people still talk about my saris, and they say, we used to come to watch your sari, to see your saris. That happens, which we have to understand. But saying that, I am somebody who loves music. So in my OR, in my OP, everywhere music runs. And there is this live music shows which happen in city in Hyderabad, Tabula Rasa, where I go. I really enjoy driving. Then suddenly people ask, you come to these places also? I'm like, we are human. We come. Please don't make us look as if we can. We're not supposed to go to that. It is like, you go to a shopping for something. Oh, you come for shopping also. What do you expect us to do? But that will be there. But that's nice. That's okay. Then they'll know that we are human too. So I think it's fine. As long as we are not doing something which is immoral, unethical, which is not the right thing to know. Like people, always say that it is better to not meet a person whom you idolize personally, because your opinion of that person should not go down. I don't think that should be the way. It is our responsibility, because when somebody is looking up to you, you have to live up to that reputation. Because what sort of example we are going to give to the next generation, unless we be what we portray. Otherwise, don't portray. Be yourself. Like I said, my motto is be yourself and believe in yourself.
Wonderful. So today I met a lady who has transformed her fear to the power and the most in the field of achieving the highest honor, and to moreover building up the friendship across the country, and a mother, a surgeon, patient lover who thinks about patient first, a professional, and a fighter. So even these adjectives are less for you,
Yeah.
madam. Thank you so much. I would like to ask you some few rapid fire
Yes.
questions, and then we can end this podcast. So one word that describes you best.
I think grit and determination. That's it. I think so.
Yeah,
I
no,
never let
perfect.
go. I never let go. That's it.
True. The most challenging surgery you have ever performed.
Most challenging. We have done everything, including ovarian transpositions, and I think still feel that endometriosis surgery will be the most, but to post hysterectomy endometriosis when it comes, that becomes the most challenging than anything, including the radical and all doesn't look as much as the endometriosis, which is in the thing. Other than that, I think rest of the things we can do it.
Thank you. The book or movie that deeply inspired you.
Roots. Roots is a book by Alex Haley. I love author Haley books, but then Roots from Alex Haley, which I read, I think, in 9th or 10th class, which talks about a Black American who goes in search of roots into the Africa and then what everything. That is one book I cried. So I never, this thing, you should not forget your roots is something which comes from there.
Wow. So we grounded to the roots,
Yeah,
though whatever the
okay.
level, we
Yeah.
fly high in the sky. So your mantra of staying positive during your tough time. So do you meditate, or how do you remain positive?
Definitely, I believe in God. I'm not a temple person, but I believe a lot in God. And I know that God will never leave me alone, and I'm God's favorite child. So rather than meditation, I just leave it to Him. It is this thing, it is your duty to make me fine. So He is the one who makes me good.
So faith.
Faith.
If not a surgeon,
Yeah.
what would you have been?
I don't know.
Pathologist.
No, never. Every day pathology has to come back home and say, I am not made to see through the telescope. In my fourth class, I told I'm going to be a doctor. And then I said, I'm going to be a surgeon. Then I said, I am going to be a gynecologist and make a difference in surgical field. So I was very clear. And I again believe, even as though the book came later, I believe that if you really want something, Sara kainat ek ho jata hai, and it makes it happen. So there's nothing what I would do except doing surgery.
So only a surgeon or
Only a
nothing.
surgery.
So one innovation in endoscopy you believe will revolutionize the field?
I think definitely which has revolutionized a lot is the ipsilateral ports, which we fought and got it into the thing that it made it. Then the surgery, I think again, doing unnecessary hysterectomies for endometriosis. CA125 is high, just open surgery and then hysterectomy. We do know that post-surgery also thing. So people have to understand that removing the disease followed by medical management is to make a difference. But then surgery is the gold standard. Doing the surgery is very important. So I still believe that quality of life of a woman is important, and endometriosis surgery is the one which is going to make a huge difference.
And the proudest moment of your career?
Is when my patients, especially I will tell you about the neovagina, which we started in 2005 until now, I think highest number we have done in the new technique, that's the Anagani technique. When a patient comes at 40, 41, and then we do it, and afterwards she'll have a normal sexual life and normal this thing, and she said, I wish I would have met before. People come from all over the world to get this particular technique done. And then they say, I would have known I would have had a normal life with my boyfriend from before. Or when last week also I got a mail from one of the patient who is a doctor herself, who delivered through surrogacy after neovagina is formed. Through the vagina, they would do the oocyte pickup and everything. So I think neovagina is definitely my most proudest, apart from the endometrial regeneration case, which delivered afterwards, and ovarian rejuvenations and everything.
Wow. So touching. Madam, you are role model for so many. But who is your role model in your life?
I think when I was growing up, one woman who was most powerful our times was Indira Gandhi. So I used to admire her power, the way she used to rule things and all.
Personality.
Yes. So she has been my role model because she died when I was doing my intermediate. So when we used to open up newspaper, ours was the newspaper times. We did not have TV and all. Remember that. TV was only Palu Chelu and all those things. So her photograph, her thing, the way she used to rule thing. So it is like that. Like I said, I was a tomboy from childhood. I was born rebel. I was like, why should boys play after 5 o'clock? Why can't I play after 5 o'clock? That sort of a person. So it has been Indira Gandhi for me.
Wow. So one piece of advice for young women dreaming big.
I think not one, 6 things you all have to remember. The first thing is all T's. For me, T mantras, 6 T's. So first thing would be technique. All of you, please learn the technique properly. Have your mentor, learn it properly. Don't be in a hurry to do anything. Second, technology. Take the technology. It keeps changing. You change with it. Third, team. Never try to do anything yourself. Make your nurses, make your technicians, everybody team. Fourth one would be the proper training is very important. Proper training, every time anything changes, you become, the new thing comes. When you're in a race, you need to run. When a robo comes, you again get trained. So retrain, unlearn and learn again. Fifth one would be teaching. Don't stop with yourself. Anything you learn, think out of the box. Keep on teaching. That's when you're not going to lose anything by teaching. They're never your competition. Your fate is yours. You're not going to take their fate too, and they're not going to take your fate. Finally, the last one, which till today I also try to do, is temperament. Your temperament in the theater, in the patients, is the one which makes you whatever you are. So all these 60s are very important. So girls out there, please take these 60s, make them your friends, and be whatever you want to be.
So clear and crystal, madam. So coming to 60, that reminds me, are you a coffee person or a tea person?
Oh, okay. I was totally a black tea person only. But recently, my colleague started me on a black coffee once a day. So, but majority black tea person. I left this small anecdote with it, story with it. I used to be a tea person because we used to study a lot, 24/7, 18 hours we used to study for MD. So my mom used to give a tea. So by the time I wrote my final year MD exam, I left tea with milk. After that, only black tea. Because whenever I see the tea milk, I will remember my MD exams. So behavioral therapy and I left tea.
Madam, last but the burning question of today, a mother.
Yes.
Or a professional. You have excelled both roles, that is no doubt about it. But what do you feel your true purpose lies more in being a mother or a professional? Which role do you believe like this time has shaped you for?
I think basically I've been a mother from a child only. I mean, as from 18 years only, because everybody calls me Amma only. I mean, even my patients call me Amma, my daughter calls me Amma, everybody calls me Amma. And it so happened that when I was in 18 years, we lost my father for cancer for 20 days. So I have become a mother to my siblings. So automatically I've taken a role of Amma, mother. So when we look at it and I look at a patient as a mother, then you will think that I am not going to give a round solution for a square problem. I have to come up with a square solution for a square problem. So it is like coming up with a solution rather than giving a solution which is in the textbooks. So I think your maternal instincts take in. So I've been basically a mother to everybody.
A mother doctor. So wonderful, madam. Very motivational, very inspirational, and through very pure, dedicated person you are, madam. We are so grateful to have you here. And I really thank Dr. Sunita Tandulwadkar, the Fogsi team, and the technical team for helping this, arranging everything. And really, you made my day today. And would like to watch this again and again, madam. Whenever we'll be down, we'll listen this
pick up the
podcast
phone
again.
and talk to me. Thank you, Dr. Sejal, and I should really thank
you,
Sunita Tandulwadkar, Fogsi, and everybody out there for allowing me and giving me this opportunity to talk to you.
Thank you, madam. Thank you so much. Thank you, Avenger team. Thank you.